you.
Can you make a short presentation of yourself?
Yeah. I am Antonella Muraro, currently the Secretary General of the European Academy of Allergy and Clinical Immunology and President-elect for the term 2015 and 17.
Okay, thank you. In EAACI, you have just released some new guidelines for food allergy.
Mm-hmm.
Can you sum up the most important highlights of these guidelines?
The most important will be to harmonize knowledge, transferring best evidence into clinical practice, meaning that we will offering to the patient the most advanced standard of care.
Okay, and to the patient, what will the care be?
The care will be to have a proper standardized diagnostic workup, to receive a comprehensive management, not only for dietary elimination diet, but also for schools, cafeterias, and improving policies at that level. That means for the community.
Okay. Do you have specific advices that you will give to the patients of how to act in everyday life?
The specific advice is to think that if they have some reaction to food, to seek timely for an allergist advice. It could be trivial, but it could be serious. And so a diagnostic workup could exclude the disease and relieve you, or could also provide you with the proper medication to rescue further reactions.
Okay. Do you have any advice in how to prevent food allergy?
Preventing of food allergy in Denmark is a very good point, as there are studies raised in Denmark, finalized in Denmark, which have shown that breastfeeding is useful until 4 months of age. After that, it has not preventive effect. That weaning introduction of solid food can be done without other restriction from 4 months and beyond of age, and then that supplementary formulas, if needed, should be hypoallergenic formulas. No unrestricted diet should be advised to mothers, to lactating mothers, or to pregnant women. So this means that pregnant women and lactating mothers should have a normal life. For prevention of allergy in high-risk children, you should just breastfeed until 4 months of age. But if you want to breastfeed longer, it's not harmful, of course. And the weaning can start also in high-risk children with a normal diet after 4 months of age.
Okay.
So smoking is prohibited.
So this is very useful for the patients. And how do you plan to implement these guidelines for the patients and with the doctors?
For implementation, we are planning to translate the guidelines in lay summaries in local languages. So we will take advantage of national patient organization groups to help us to translate in the national language, but in a language which is plain and accessible to patients. And the second point will be to raise at the local level, the national country level, groups of stakeholders who can identify barriers, see resources, and adapt the guidelines to the local needs.
Okay, so you want to adapt the guidelines both with allergy specialists, but also with the general physicians.
Exactly.
Okay, so these really helpful guidelines. What are your hopes for them in 10 years? What are you hoping to see in 10 years?
In 10 years, I would hope that the patient who is suffering from food allergy cannot waste his time in finding a good specialist. And when you approach any specialist, the primary care, allergist and gastroenterologist, there is an harmonized approach in the diagnostic workup and in management care. Ultimately, in 10 years, I hope to find a cure.
Okay, and you also hope to find fewer people with food allergy, I
Yes,
guess.
exactly.
Okay, thank you very much.
Thank you to you.